National Institute for Communicable Diseases warned this week that despite South Africa entering its peak malaria season, many cases of malaria are now being misdiagnosed as Covid-19. Let's talk more about this then with Dr. Angelique Coetzee, Chairperson of the South African Medical Association. Dr. Coetzee, always a pleasure to have you on Newzroom Afrika. So, misdiagnosing malaria as COVID sounds to me as though doctors are failing patients. Is that the right reading?
Oh, good evening. No, it's not the doctors that are failing. I think it is because the clinical symptoms of Omicron and malaria are extremely closely related. And if I can give you, if you come into my surgery and you have chills, body aches and pain, feeling of fever, flu-like illness, you can have a diarrhea, you can be a bit nauseous, you can have vomiting, and you say, I'm not feeling well. Because we are in a pandemic, the first thing that we all would think is this might be COVID-19. But we forget that malaria actually presents with the same symptoms. So you can see a malaria patient while coming in, while the parasite is being released into the bloodstream, that patient will come in sweaty, sick, not feeling well. But in between the cycle, so it's got a 48-hour cycle. So in between, the patient can only present, like I've said, with a bit of a chill and a flu-like illness. And if you do not suspect that this patient has been traveling or coming back from a malaria area, or even living in an area where that's endemic to malaria, you might miss this because COVID is on your head. So we are from a South African Medical Association. We are asking patients, please tell your doctor if you have been traveling, test for malaria as well as for COVID, but first test for malaria. The second thing is, if you are staying in an endemic place where there are malaria, you have to insist to get a malaria test. Please, our season is between October and May. Remember, we are now moving out of the COVID or the fourth wave, but we are expecting our fifth wave around about May. And during that time, it's still malaria season. So it's extremely important to get tested.
Where I'm sitting, doctor, this should all be able to be resolved through a COVID test, which would then come back negative and alert the healthcare worker, the doctor, that it is indeed not COVID. Am I right? Is that what would settle it?
Yeah, but in this case, what you need to understand is that if you present with malaria, because malaria is a serious disease and it can be fatal. So if you present to the surgery and you are living in, for example, let's say Nelspruit, or you were at Mozambique, you come back and you've got this fever and not feeling well, you have to do the rapid testing of malaria. It takes about 30 minutes. If the rapid test and simultaneously send away the PCR, because the PCR takes 24 hours. So your window of opportunity to treat these patients, especially within the first 48 hours, is the best. So if you can treat them then with malaria, you prevent the progression of malaria. So if you first wait for your PCR to come back, that's another 24 hours. Then do your rapid screening or send off to a lab. You are actually using time. You're running against time. So you have to do it. So it's so important for patients to say to their doctors, look, I was in a malaria area, don't feel well. Please test me for malaria, test me for COVID. Remember, the other thing about malaria is your incubation period is normally between 7 to about 28 days. But you can even get malaria presenting with symptoms about anything from 7 days up to 12 months later. So you have to always have a suspicion, a high index of suspicion if you are a doctor, especially if that patient stays in an endemic area. to test. Please, the testing is so important.
The other concern raised by the NICD has been that what COVID-19 has done is it's pulled away resources from malaria programs. How dangerous is that, especially in areas where malaria is endemic?
It's so dangerous. So if you look at the World Health Organization, they estimated that in 2020, about 241 million clinical cases of malaria occurred. And 600,000 people died of malaria, of which 90% was in children in Africa, sub-Saharan Africa. So it is really a huge problem, and we forget this. We need to make sure, how do I prevent it? I'm going to go to Mozambique, or I'm staying in an endemic area. How do I prevent it? So you try to prevent the bites. And the important thing is to understand that the female mosquito is responsible for this. She normally bites after 6 o'clock at night, with the highest risk around about early morning hours. So if you can have an aircon on, you use something like tablet or any of those sprays that you can use, or you burn them, and screen your window, bed nets, very, very important. So because you cannot, if you stay in an endemic area, you cannot take the tablets the whole time. So that's how you try to protect yourself. And then if you are traveling, especially out of the country, especially to Mozambique, you have to add your tablets with this other precautionary measurements.
So in South Africa, I know the areas that do have a bit of a malaria problem, shall we call it, are KZN, Limpopo, and Mpumalanga, according to the NICD. Is traveling there also something that we should be aware of, especially during that period of October to May when it is malaria season?
Yes, it is extremely important. And again, so, if you can empower the people with the symptoms and telling them, it feels like flu, except you don't have the running nose, you don't have the sore throat, you've got the body aches and pain, you've got the sweat, you feel that fatigue, exactly very much similar to Omicron. Please, if you have been to a malaria area, keep it in the back of your mind. Ask your doctor to test. If you stay in an endemic area, test for malaria and also test for COVID. Remember what I've said, the PCR test takes 24 hours before it comes back. We're running against time with malaria, especially with falciparum. You want to treat that patient as early as possible, so you need to make that diagnosis. And the rapid tests are not very expensive, and they are highly effective. So if you use that rapid test in your surgery within 30 minutes, and you have used also the rapid test for COVID, the rapid COVID test is about 3-4 minutes, and you have your rapid malaria test, and both are negative. Then you can follow it up if the symptoms deteriorate. You can follow up your malaria test within 24 hours, and your PCR or your COVID test around 72 hours later.
Dr. Angelique Coetzee, good to have you on the program tonight. Thank you for your time.
Thank you so much.